So now let me introduce our speaker. Our speaker for today's webinar is Amy Keefer. Amy Keefer is an assistant professor at Johns Hopkins School of Medicine and Department of Psychiatry and Behavioral Sciences. She is also a licensed clinical psychologist and a clinical psychology supervisor at Kennedy Krieger Institute for Autism and Related Disorders. It is our extreme pleasure to have Amy with us today. So without further ado, Amy, take it away.
Thank you. So just to let you know, oops, seem to be having some slide difficulties. There we go. Today we're going to have a number of objectives. First, we're going to be talking about the impact and causes of stress for parents and other caregivers of children with autism. I'm also going to be talking about strategies to manage the stress associated with this very highly demanding job. My presentation will include information from research studies examining caregiver stress and also my clinical observations from my work with caregivers of children with autism. But before we go any further, I'd like to get a sense of who is in the audience. So if we could do a poll so I can find out who's out there, that would be great.
One second, and I will launch the poll for you guys to see. And if you let me know in the chat box if you are not able to see it pop up. Awesome. I see a couple of you answering in the chat box, so I will look at your answers, and then it seems like most of you are parents of either a child or an adult with autism.
Great, great. So I'm pleased to hear there are a lot of parents and other caregivers in the audience today. You all are the experts on this topic and can best speak to your individual experience of raising your child or children with autism. Although each caregiver's experience of raising a child with autism is unique in some way, there are commonalities in these experiences, which I'll talk about today. Additionally, I'd like to note that almost all of the research available about caregiver stress pertains specifically to parents and primarily mothers. So we do not yet know much about the specific experiences of other caregivers like grandparents. However, I hope the information I provide will have relevance for all caregivers. So just to get started, exactly what is caregiver stress? So caregiver stress is defined as a psychological reaction to the demands of being a parent. Although the picture on your screen appears to be of a mother, stress can affect all caregivers, including dads, grandparents, foster parents, adoptive parents, and aunts and uncles. It can affect anyone providing care to someone else. Additionally, caregiver stress is experienced by all caregivers, whether the person they're caring for has autism or not. Caregivers can experience stress at any stage in their child's development. As we'll discuss later, the reasons for caregiver stress are not static and typically change across child's development as the child and caregivers encounter new demands and challenges. The reactions to stress also vary across caregivers. This occurs in part because the demands caregivers face also vary. The needs and capabilities of individuals with autism differ significantly from person to person. Additionally, the supports and resources available to caregivers, as well as their personal understanding of the experience of caring for an individual with autism, are also highly variable. These differences affect the level of stress and the specific thoughts and feelings experienced by caregivers, even when they're in the same family. For example, when some caregivers experience stress, they may experience negative thoughts about their own caregiving and may blame themselves when things do not go well. Caregivers can also experience frustration and anger toward the individual they're caring for due to the limitations caregiving places on their life and the challenges that are created by caregiving. Although it's important to be aware of these reactions and the impact they may have, these thoughts and emotions are all very normal and make sense in the context of the caregiver's unique experience. Research has provided us with theoretical models through which we can understand the dynamic quality of caregiver stress, as well as its variability between caregivers. The model on your screen was developed by researchers McCubbin and Patterson to describe how families adjust and adapt to stressors. This model illustrates how family adjustment is impacted by both the demands caregivers experience and the resources and coping strategies available to and utilized by them. In order to maintain balance, the utilization of resources and coping must be equivalent to the demands placed on the caregiver. Additionally, the meanings developed by the caregiver, which refer to how the caregiver understands and thinks about his or her experience of caring for an individual with autism, directly affects this balance. For example, maladaptive beliefs about the caregiving experience, such as the caregiver blaming himself or herself if his or her child does not meet desired goals, may increase the negative impact of demands on the caregiver and undermine the effects of positive coping strategies. All caregivers experience times when the scale gets off balance. However, what's different for caregivers of individuals with autism is the fact that they're often faced with chronic and more intensive demands than other parents, and must constantly work to maintain equilibrium. It is thus understandable that the scale becomes off balance more frequently, and that caregivers of individuals with autism require more help to cope and manage family and personal needs. So now I'd like to just take a quick moment and hear a little bit about the stress that's experienced by caregivers in the audience today. So if we could do a quick poll, just so I could hear a little bit about the stress you've been feeling in the past month, that would be great.
Hi, folks. I just launched the poll, so if you could use that feature and answer. If you don't see it again, oh, I see a ton of people answering, so that's awesome. Thank you so much. Got about 24 seconds, so about 5 more seconds, and I'm going to close it and give you guys the data that we pulled. All right, so in rating the amount of stress that you have experienced in the past month, only one person said hardly any stress, 10% of folks said mild stress, the overwhelming 54% had moderate stress, and then 36% of you experienced severe stress. Thank you for answering.
Yes, thank you. So the responses that you provide, I think, are very much in line with the type of information we get through research of caregivers with autism. Research has clearly demonstrated the effects of stress on parents of children with autism, and that this stress is often chronic and can last across the caregiver's lifetime. Stress levels are considerably higher in parents of children with autism than in parents of typically developing children, and interestingly, also higher than parents of children with other developmental disabilities. The rates of anxiety and depression are also higher in parents of children with autism. In a study by Bitsika and Sharpley, it was found that 45% of mothers and 48% of fathers of children with autism reported symptoms consistent with an anxiety disorder. 55% of mothers and 49% of fathers of children with autism met criteria for a depressive disorder. We think that the differences in stress experienced by caregivers of children with autism compared to other parent groups are likely due to the unique symptoms of autism and the mixed developmental profile that often accompanies autism. For example, I've met many parents who are struggling to determine the best plan for their adolescent's transition to adulthood because their child is bright and has many strengths, but also has significant difficulty with executive functioning skills like self-initiation, planning, organization, and self-monitoring. Existing educational and vocational programs are not appropriately equipped to both challenge and support these young adults. This mixed profile can also create confusion for parents who struggle to determine how best to support their child's independence while also establishing appropriate limits to ensure their safety and success. In addition, some of the social challenges experienced by individuals with autism can directly affect their ability to create and maintain the social emotional connection that's desired by their caregivers. Again, I want to mention that this is not the experience of every caregiver of a child with autism, but that these types of challenges can play a role in caregiver stress. Now, returning to the rates of anxiety and depression, there's a large body of literature demonstrating that chronic stress is a risk factor for mental health conditions. The chronic stress associated with parenting individuals with autism can also exacerbate pre-existing mental health disorders. So it is not a surprise that many caregivers of children with autism also meet criteria for an anxiety and/or depressive disorder, and sometimes require their own care to manage the symptoms associated with these conditions. While mild to moderate levels of stress are part of the human experience, and actually can be quite adaptive, as stress motivates us to complete important tasks and attend to key information. High levels of chronic stress are highly detrimental and can cause a variety of problems. Stress can degrade the well-being, both physically and emotionally, of caregivers. Stress increases risks for multiple medical conditions, decreases immune functioning, and can lead to disturbance in sleep and eating patterns. As mentioned on the last slide, stress also increases risk for anxiety, depression, and other mental health concerns. We also have learned that chronic stress undermines the quality of parenting and other family relationships. Often this occurs because stress creates emotional fatigue that limits the ability to focus on others' feelings and needs and the ability to regulate emotional reactions. As a result, individuals end up reacting impulsively rather than reflecting and then responding to family members and other individuals. Chronically stressed caregivers also often experience a decline in energy that limits their ability to meet the many demands of caring for their child's special needs, such as running to multiple appointments, implementing various treatment strategies, attending IEP and other meetings, and advocating for their child at school and in the community. Research has demonstrated that parental stress levels are negatively associated with the child's response to treatment, and that parent stress can actually counteract the effectiveness of interventions for the child. Researchers speculate that this occurs because stressed caregivers have more difficulty implementing treatment strategies in the home. It also may occur because children can experience negative reactions, such as tantrums, anxiety, and withdrawal, when they observe stress in their parents or other caregivers. I share this information not to place additional burden on caregivers, but to emphasize that reducing caregiver stress is essential to the well-being of the entire family. Now, if we return to our model of family adjustment, I would like to spend a little time discussing how the demands associated with raising a child with autism contribute to stress. We know that caregivers of children with autism face a variety of changing demands as the child matures. In the early years, caregivers are often dealing with the stress of getting an accurate diagnosis, establishing a treatment team, learning about the diagnosis and the multitude of specialists and treatments related to autism, and adjusting to the changes in expectations and family identity that may accompany an autism diagnosis. During the school-age years, caregivers must focus on working with their child's educational system to negotiate the best classroom setting, school-based interventions, and accommodations to support their child's success. This is also the time when children may begin to experience their own stress and other negative reactions due to unsuccessful social interactions or other negative life experiences. Observing this stress in their child can also exacerbate the pressure and stress experienced by caregivers. During adolescence, caregivers may face new stressors, such as comorbid mental health conditions that may emerge during this time. If the teen experiences a mental health disorder, his or her caregivers must learn about a whole new diagnosis and to find additional professionals who can address this new areas of concern. Adolescence can also be a time when aggressive and other maladaptive behaviors become more difficult to manage due to the teen's increased size. New stresses also emerge when adolescents begin the transition to adulthood. At this time, caregivers must assist their young adult in developing and enacting a plan to acquire the level of independence appropriate for them. However, there are insufficient programs and supports for adults with autism, which further complicates the picture. As I mentioned earlier, determining the best plan can be very difficult and can sometimes lead to conflict between the new adult and his or her caregiver. Additionally, caregivers are often facing new challenges related to finances, medical decision-making, and insurance coverage for their young adult. Thus, the demands associated with caring for a child with autism are ever-changing and require the endurance of a marathon runner. Now, research has identified a link between the demands associated with raising a child with autism and caregiver stress. In fact, there are studies documenting the link between a child's autism symptoms and parental stress, with some studies finding that the severity of the child's autism symptoms is positively correlated with parental stress levels. Research also shows a clear relationship between aggression and other maladaptive behaviors like self-injury and temper tantrums on parental stress. Some studies also indicate that these maladaptive behaviors have greater impact on parental stress than do autism symptoms. Additionally, other problems associated with autism, like disruptions in feeding and sleep routines, significantly impact caregivers and contribute to their exhaustion and stress. Therefore, it is easy to see why the scale may get tipped in the direction of excessive demands and expectations. Now, if we turn our attention to the other side of the scale, we see that another key factor in understanding caregiver stress is capability, which refers to the use of resources and positive coping strategies. We know that there are not enough resources available to caregivers of individuals with autism, which creates additional challenges in balancing the scale in response to demands. As we already discussed, many caregivers find it difficult to find providers who have appropriate training in autism. And this can be further complicated by insurance companies, which do not cover the services or specific providers that are needed. Educational resources are also often in short supply, and parents sometimes face educational systems who don't understand autism or the challenges that families face. There's also considerable evidence documenting that parents of children with autism experience lower levels of social support than caregivers of children with other developmental needs. Sometimes this arises due to strained relationships with extended family members who may not understand the child's needs and are judgmental of the parent's parenting style. Caregivers may end up feeling judged and criticized and thus do not receive valuable social support from their family. There is also evidence that parents of individuals with autism have fewer friendships than other parents. It is speculated that this occurs because parents of children with autism have less time for social activities and may feel judged because of their child's behaviors. It also may occur because friends express discomfort about being around the child with autism. These limitations to caregivers' social networks reduce the availability of social support, which is known to be one of the most important coping resources to manage stress. Caring for an individual with autism can also lead to a depletion of financial resources. In a recent study, it was found that it costs $17,000 to $21,000 or more per year to raise a child with autism due to the costs associated with multiple treatments, specialized childcare, and the equipment and tools needed to maintain the child's safety and implement treatment recommendations. Financial resources can also be limited because one parent, often mothers, often leave the workforce to care for the child's needs. Not only does this reduce family income, it may also reduce available insurance coverage for needed treatments. There has been extensive research demonstrating that how humans respond to their life experiences arises from the meanings they create about these events. Raising a child is one of life's most significant and impactful experiences. No one emerges as the same person or views themselves or the world in the same way after this experience. Raising a child with autism has its own unique impact on the caregiver. Learning that a child has autism can impact a caregiver's sense of identity. For example, if a caregiver previously thought of him or herself as a very outgoing social person, and then finds that they can no longer engage in the types of social interactions that they enjoyed in the past due to their caregiving responsibilities, the caregiver's self-identity is directly challenged. Additionally, caring for children with autism can lead some caregivers to blame themselves when things do not go well, or if the child does not progress as hoped. This can lead caregivers to doubt their decision-making ability and to experience feelings of failure, incompetence, and hopelessness. These thoughts and feelings can paralyze families and prevent the child and family system from growing and adapting. Raising a child with autism can also impact a caregiver's definition of achievement and success and alter the goals of the caregiver's life. Although this can ultimately result in personal growth and be highly adaptive, the process can be difficult, and some caregivers struggle to redefine their understanding of themselves and their life. If they do not develop positive meanings and instead maintain negative views of themselves and their family, they will likely experience more detrimental effects from demands and less benefits from coping resources. Now, let's return to our model of family adjustment. We've spent some time discussing how this scale gets off balance. However, this model can also provide guidance about how to best manage the stressors associated with parenting a child with autism and move toward establishing equilibrium. So this is a picture of our model imbalance. Balancing this scale involves several elements. These include reducing demands when possible, maximizing coping and resource utilization, and developing new positive meanings about the caregiving experience. Although challenging, creating balance is possible and can result in a multitude of positive changes for caregivers, children with autism, and the family as a whole. Although there are definitely some demands that cannot be controlled, there are some challenges that are experienced by caregivers that may be able to be reduced. First, it is important that caregivers feel that they have a strong treatment team that is actively working with them to provide guidance and support. Research has demonstrated that parents of children with autism feel less stress when they are working with healthcare providers who are knowledgeable about research-based treatments and who collaborate with them to implement these interventions. Additionally, research has demonstrated that parental stress reduces when parents participate in treatment programs that provide them with instruction regarding strategies to address their child's autism symptoms and associated behaviors, like temper tantrums and aggression to self and others. Although we do not know for sure why parents experience these gains in response to participating in treatment for their child, we can speculate that it is likely due to parents' increased perception of competence in the skills needed to facilitate their child's growth and to reduce problematic behaviors. Finally, it is important that caregivers do not minimize the importance of getting help for their child's disrupted sleep and feeding patterns if these issues cause stress for the family. The disruption of these basic routines can wreak havoc on the emotional and behavioral regulation of all family members. The good news is that there are many effective treatments for these areas of concern, and that addressing these issues can lead to gains for the child and the family. Caregivers who wish to pursue parent training interventions may want to first consult with a university-based autism clinic. If there isn't a university-based clinic in the family's local community, it may still be helpful to obtain an evaluation at one of these centers, as providers at these locations may be able to refer parents to other qualified providers in their local community. A list of university-based autism treatment programs can be found by consulting the Autism Treatment Network website. The website for this group is provided at the end of this talk. Now moving on to maximizing coping and resources. This is probably one of the most important steps in managing stress because caregivers often have more control over this than they do over the demands placed upon them. If we refer to our model, we see that when demands increase, the way to restore balance is to increase coping. One of the most important coping strategies is to engage in self-care activities. Self-care includes anything that creates a positive, renewing experience for the caregiver. Self-care is specific to the caregiver's preferences and can include anything from reading a book to taking a walk, eating a favorite food, getting a manicure, attending a concert, etc. Coinciding with self-care is the need for taking time of respite from caregiving responsibilities. Respite care has been demonstrated to reduce stress, as well as improve marital quality in parents of children with autism. For some families, respite can be provided by asking friends or family members to provide childcare for a period of time. However, if caregivers do not have individuals who can provide this for them, or if family and friends cannot manage the child's needs, national programs like the ARC and some state-level programs, such as individual states' Departments of Human Services, provide funding and in some cases access to individuals who are specially trained to provide respite care to people with special needs. Some caregivers can experience guilt or worry about the idea of hiring others to care for their child or children. However, respite is often the first step to self-care and is necessary if caregivers are to maintain the endurance needed to parent effectively. When talking with caregivers about this fact, I find it's often helpful to refer to the instructions we receive from flight attendants before takeoff. If the plane loses cabin pressure, caregivers are instructed to place their own oxygen mask on their face before they help their child. This is recommended because caregivers will be of no use to their children if they're not able to breathe. Caregivers of individuals with autism are encouraged to remember this principle, and that prioritizing their own self-care is essentially a way to maintain oxygen, so to speak, to the child's main support system, them. Sometimes it's also important for caregivers to pursue their own treatment, to learn new ways to cope with the stresses they are experiencing, and to address mental health difficulties that may have arisen or have been exacerbated by caregiving stress. Although self-care and respite are incredibly important, they do not help caregivers learn new ways of coping if the current methods aren't working. There has been some research into the use of specific treatment strategies for mothers of children with autism, and the use of mindfulness-based stress reduction, or MBSR, has been noted to reduce mothers' stress, anxiety, and depressive symptoms. MBSR involves teaching caregivers to use specific breathing and movement techniques to observe their own emotions and thoughts without judgment, to increase focus on the present rather than on worries about the past or future, and to treat oneself with kindness. Although MBSR has been demonstrated to be helpful for some caregivers of individuals with autism, it may not be the right strategy for everyone. And there are other intervention approaches, such as cognitive behavioral therapy, that may be more helpful for some caregivers. So it's important that caregivers who are experiencing mental health conditions or general difficulties with coping work with a mental health professional to determine what treatment is best for them. Caregivers often report that they feel better understood when they receive treatment from mental health providers who understand autism. Some university-based autism clinics, such as those in the Autism Treatment Network, also offer treatment to caregivers. Caregivers seeking their own treatment may wish to consult these clinics or other autism-specific programs to locate their own mental health provider. Social support has also been demonstrated to reduce stress, anxiety, and depression in parents of children with autism. Given the limited social support experienced by many caregivers of individuals with autism, it is not a surprise that directly increasing social interaction has positive benefits. Notably, these benefits can occur for parents who obtain social support through parent-led groups, individual meetings, and online interactions. Caregivers can also experience benefit from participating in social interactions that are not autism-focused, but involve caregivers who accept and understand them and their children. Caregiver support groups can be found through some national organizations like Autism Speaks, Autism Society of America, and the ARC. Online support is another popular option and is available through the Interactive Autism Network and several other websites, including myautismteam.com. The demands of caring for a child with autism can also strain the marital relationship, as the demands of caring for a child with special needs can negatively impact communication, exacerbate areas of conflict, and reduce emotional connection. Similar to caregiver stress, the health of the marital relationship has direct impact on the well-being of the child and the entire family. Therefore, it is important that caregivers prioritize their relationship with their partner or spouse and work together to establish a unified approach to problem-solving issues related to the care of their child or children. Sometimes caregivers need help prioritizing their relationship and addressing areas of conflict. So it is sometimes advisable for caregiving partners to initiate couples treatment, to work out these differences, and to develop a unified approach to caring for the family. So now we'll move on to the third area which caregivers should consider in managing their stress. Creating positive meanings from stressful and demanding situations can be extremely difficult. However, the ability to revise old beliefs and create new positive understandings is incredibly important to maintain a caregiver's well-being across the lifetime of care they will provide to their child with autism. The creation of positive meanings usually starts by working toward accepting the personal and family changes that have occurred as a result of caring for a family member with autism. It is important that caregivers maintain realistic hopefulness regarding their child's and their family's future. Although this will likely mean changing previously held expectations for the child's and the family's life, the image of a new potential can be very motivating and affirming. It is also important that caregivers look for hidden joys and rewards that arise from caring for an individual with special needs. Again, these rewards may be different than what caregivers experienced when raising another child, or than their experiences of what it would be like to care for a child. However, this journey can provide new positive experiences that can be uplifting and rewarding. As I mentioned previously, creating positive meanings can be difficult, particularly if caregivers are caring for an individual with intense and frequent maladaptive behaviors like aggression. Caregivers often require additional help with this meaning making and can experience benefit from social support from other caregivers and by working with a mental health provider to develop new meanings. So in summary, caregivers of individuals with autism are an incredibly dedicated, resourceful, resilient, and inspiring group of people. However, due to the demands and limited coping resources associated with this role, they experience high rates of stress, anxiety, and depression. However, this can be managed by reducing demands, maximizing coping resources, and creating new meanings from their experiences. And finally, I'd like to provide you with a slide with web links to some of the resources that I talked about during my presentation. And that's it for today. I guess we can take questions.
Hi, everyone. I wanted to first thank you all for being so engaging in the chat box. Sorry, we're hearing a little bit of an echo. I'm going to read some of the questions that you guys posed, but I'm really glad that a lot of folks have said that the conversations in the chat in response to Amy's presentation have been really helpful too. So let me ask some questions, and then Amy, if you don't mind answering, that'd be wonderful.
Sure.
Let's see. So a lot of people said that their children experience PTSD type symptoms, and there was just kind of a general question about, you know, if you have any suggestions on how to deal with, you know, this ranging severity of those type of symptoms stress-wise for the caregivers.
Right. So I think our understanding of trauma in individuals with autism is just really beginning to emerge. I've been excited to see that there has been some early research in this area. While that has not directly addressed the needs of parents of children with autism who've experienced trauma, I think that a number of the strategies that we use in supporting parents of children who've experienced trauma who do not have autism could be helpful. In some cases, parents, I think, experience their own trauma in hearing about their child's traumatic experiences. And so there can be times when parents may need to work with their own provider to work through some of those feelings. However, in other cases, it can be helpful for the parents to work with providers who have a solid trauma understanding, trauma background, and are giving the parents strategies where they can both help the child process their own feelings and then also giving them self-care strategies for themselves, relaxation strategies, just to help them work through all the stress that goes along with that process.
Awesome, thank you so much. Some folks have been asking about, you know, when there's multiple children in the household, you know, how you take care of your own health priorities and make yourself a priority like you mentioned, but also take care of a neurotypical sibling in a household, you know, that obviously is in the same environment as the rest of the family, and you know, how do you prioritize those children as well?
Yeah, I know that is a really big challenge for families. They talk about it often here at our clinic. So I think one of the things is kind of continuing as best as possible to create special time for the parent and other siblings, whether if that's like a special lunch or just time away where it's just the child, the other child, and his or her parents. I also know that sometimes siblings benefit from being able to talk to other siblings about their experiences. And there's actually a program that's designed to facilitate this called SIB shops that are available nationally at lots of different locations. And SIB shops is actually a program where siblings of children with autism get together. They have sort of both some open-ended discussion, but also structured activities just around processing what it means to be a sibling of a child with special needs. So that's something I would definitely encourage families to look into if you feel like your child, the sibling of your child with autism, really has additional thoughts and feelings they need to explore.
Great, thank you. We have had some conversation in the chat about medication and whether that, you know, if you have any recommendations, or if you, or generally speaking, if you recommend that being an avenue after certain other, you know, behavioral methods aren't, you know, the child isn't responding to, and, you know, just what are your thoughts about medication and maybe access to providers? A lot of folks are saying that they drive an hour both ways to therapy, and you know, whether or not seeking out additional help is something they should prioritize.
And just to clarify, this is medication for the child?
Yes.
Okay, right. So yes, I know families often have to drive a really far distance to try to connect with providers who have the right skill sets and also know autism to work with their child. Medications are an option for some types of behavioral challenges, but I think it's a very highly individualized decision about whether or not medications make sense for a specific child with autism. As I'm sure you're aware, you know, there's different levels of benefits that we can expect from different medications, and also different types of risks and just negative connections. So I think it would be really important for providers to talk with, parents to speak with providers about the use of medication and decide if it makes the most sense for their child and family, given what's demonstrated.
Okay, awesome. We have had some folks asking about, you know, whether seeking out groups for parents is something that you've seen be a helpful resource, and maybe other similar, you know, forming communities in their area, and how you suggest maybe starting one for folks that haven't found that resource available to them.
Yeah, so I think connecting with other parents who've had similar experiences is an incredibly important way for parents to cope and get support, and really kind of also just get information about what they need to take care of their child. I do find, though, that parents have a range of responses and kind of give me a variety of feedback about parent support groups. Some parents, I think, really like that format, and they like being with a large group of people where they can make lots of connections and get a big range of information. I think some other people might find that a little bit overwhelming and may not be the most comfortable way for them to get their social support. And so for those families, I think they often do better with more of the online format. And also maybe connecting with one or two sets of parents that they can form a close relationship with and maybe meet with more individually. So it's not quite as large of a group of experience. There are, I think, growing numbers of these groups and also growing numbers of online support groups, which is really exciting to see. In terms of developing your own group, I think that would be something that would be really good to talk to some of the national organizations about, if it makes sense to develop a chapter in your area, or if you have just a group of parents that you know of that would like to start getting together and creating a support group. I think just kind of getting that rolling and advertising, I suspect you'll find quickly there's a big, excuse me, audience for that.
Thank you, Amy. We have had a lot of folks mention respite care and kind of wanted to get your feedback on it and just kind of see what your suggestions are. I think that would answer a lot of folks' questions. Thank you.
Sure. So respite care, I think, is incredibly important for parents. I think it's an underutilized resource. However, I also understand there sometimes can be challenges accessing it. So I think often the easiest or best way to go about accessing the respite care is, if it's possible, to connect with someone like a care coordinator or social worker. We have folks that have those roles here at our clinic that help parents understand all the different ins and outs about respite care, including who the funders are, who the providers are, and then helping to do the types of paperwork that goes along with that. So I think especially maybe when you're looking into respite care for the first time, if you have access to a professional like that who understands these systems, that would probably be your best route to getting something like that set up. Unfortunately, I know that the number of trained individuals that you can hire to provide respite care through these programs can sometimes be pretty limited. I think that can be challenging. However, I have had families report success in potentially hiring teacher aides or paraprofessionals who work with their child and already have a good relationship with their child, or ABA providers that can then also be hired to provide that respite care. So these would be individuals who already know your child and your child knows them, and who have skills in managing your child's needs. So I think sometimes if you get the funding, but you're having trouble finding the person to provide the care, that can be another route to go to potentially set that up.
We also have had a couple folks mention, the stress of moving and finding providers in that area. And I know that some folks are actually incentivized to move based on the services offered in certain areas. I'm not sure if you know, but I wanted to ask if you have any suggestions for particular places that have a high level of care and, closer access rather than things that are so spread out geographically. And if you can kind of shed some light on that process.
Sure, yeah, I know relocating can be really challenging. I mean, it's stressful for any family. And then if you have a child who doesn't do well with change and likes routine, then it's going to just make that a whole lot harder, as well as finding the providers. So in general, I can say that, I wish it weren't this way, but I think the place that most of the experts or specialists are located tend to be urban areas where there are university-based autism clinics. So, if I go back to the list of clinics on the Autism Treatment Network, those are the places that really will have highly specialized care for autism. Unfortunately, that doesn't always mean that the states they're located in have as equally strong resources. But I think if you have a strong center like that that's close by, you know that you'll be able to access high quality resources, at least on an outpatient basis, and hopefully get guidance about how to work within your community to access higher quality care.
Thank you. We also wanted to ask about, for the instances where folks are on a waiting list to see a provider that may or may not provide a diagnosis for them to move forward, gaining access to resources. For that particular time that they're in limbo, do you have any suggestions that, I know you mentioned several things, and a lot of folks have recommended certain therapies that aren't medical in the chat box, but during that waiting period, how do you suggest, helping reduce stress on the family dynamic and for the child themselves?
Yes, so I think sometimes families will decide to wait to begin treatment until they get a diagnosis. And while in certain situations that could make sense, or there could be some insurance limitations, for the most part, families are usually able to start treatment right away, even without an autism diagnosis. So I'm thinking of like treatments to address maladaptive behaviors like aggression or temper tantrums or emotional dysregulation. Often those specific types of difficulties can be treated and would be eligible to receive insurance reimbursement for treatment, even without the autism diagnosis. So I strongly encourage families to seek out treatment while they're waiting and not to wait for the final word on the diagnosis. Also, I'll just add, sometimes when those types of issues are a little bit less severe, it can make the diagnostic picture a little easier for the clinicians assessing the child as well. I also think, my talk was very much about getting support for families after the autism diagnosis, but there's no reason why parents need to wait until then. If the stress you experience because of the behavior challenges you might be dealing with are the same before the child gets the diagnosis and after. So if you're having that high level of stress, getting extra support, maximizing coping resources, accessing your own therapy, I think all of that makes sense to start earlier and not just wait for the diagnosis to decide that.
Thank you. Let's see, if you guys want to send in some questions, we have about 5 minutes left. I know a lot of you guys are, talking to each other, but if you have any questions for Amy, we'd love to utilize her expertise. And also, I did want to address, we will be putting this webinar, like all of our webinars in the past, on the Spark website in the Discover section. If you send me your email, I can try to send it to you directly if there's not too many folks, but otherwise keep a lookout on the Discover page, and you can also look at past webinars. We have it all in one place. Let's see, just gonna go. Also, we do have a certificate of attendance for those of you that asked. It just doesn't, the attendance doesn't equal any credit for programs that may require that. We do have a question about sleep, and also want to, before we end, I want to talk, see if you could talk a little bit more specifically about self-care for providers. A lot of folks have said that certain activities that they'd like to do, they don't have enough time, financial burdens, so if you could answer about some more examples of self-care that are, realistic for some families who just aren't able to access certain things. A couple people said, sometimes there's not enough time to shower or even brush their teeth. So, and then also just about sleep in general. Thank you.
Sure. So in terms of self-care, I understand. I know there's some families, it is just hectic from the moment you arise to the moment you go to bed. So for those families, I think sometimes self-care can mean looking for just carving out the smallest little space of time for yourself, whether that's figuring out a way that your child could be self-entertained and monitored by someone else in your home while you're still there for a period of 15 minutes, or maybe trying to figure out if you can put your kids to bed a little earlier so you can carve out a little bit of time for yourself. Really trying to look for creatively for times that you can carve out to do even a little something like read a favorite book for a few minutes, or soak in the tub in a bubble bath, or whatever you do to relax. I think that is probably, I understand that in certain situations, that's probably what you're going to be able to carve out, at least until some things might change developmentally. And I also realize that resources are limited. So it's important to recognize what those, other joys in life are that don't necessarily involve a lot of, that are highly expensive. It doesn't have to be going to some extravagant spa to relax. It can be simple things like reading a book, even watching a part of a movie, something like that, that just gives you some time for yourself. Because I know even sometimes those little bits of time can be really hard to carve out. And I think even being able to do that can really have big benefits for families. And then I guess the other thing was just general questions about sleep. So we are learning more and more that sleep challenges are very common in individuals with autism spectrum disorder. And those difficulties can be problems getting to sleep, problems staying asleep, just sort of general disruption of the sleep routine. And what we also know is that when sleep is disrupted, it creates a lot of problems for the child and the family. It can exacerbate all of the autism symptoms, and it can exacerbate the problems with mood and anxiety and behavior problems. So sometimes when we see families where there are sleep difficulties, we actually think of sleep as one of our first places to intervene. Because sometimes a lot of the other challenges will get somewhat better in response to positive gains with sleep. So at Kennedy Krieger, we actually have a sleep disorders clinic. And if children have sleep problems, they're evaluated by a multidisciplinary team, because sleep problems can have more of a medical component, and they also can have more of a behavioral component. So sometimes there can be medical reasons that contribute to difficulties with sleep. Sometimes it can be more related to sleep routines and specific behaviors with the child. And sometimes it can be both. So it's really good to work with professionals who understand that and can tease that apart, and then make recommendations about which piece, the medical or behavioral or both, makes sense to target to really help your child. Sometimes this doesn't require as extensive of a team as the sleep disorders clinic at Kennedy Krieger. Sometimes, just talking to your pediatrician can be sufficient. I just think it's important to keep this on families' radars. I've talked to a lot of parents where they're just kind of dealing with so much, and they've gotten just so used to having disrupted sleep that they forget to recognize how much that's actually impacting them and sort of forget to bring it up. So I think just really bringing that to the forefront of your priority list would be helpful.
Okay, thank you so much.